PCOS is a chronic condition that will impact you off and on for the rest of your life, but it can be managed. Hi, I'm Dr. Ryan Dickerson, and I'm an OBGYN at Louisiana Women's Healthcare in Baton Rouge, Louisiana. And we're here today to talk about Polycystic ovarian syndrome, or PCOS. To have PCOS, a woman must have 2 out of 3 criteria. The first is she must have evidence of not ovulating or abnormal menstrual cycles. If you have normal menstrual cycles, you still may have PCOS, but most women don't have normal menstrual cycles. Therefore, they're not ovulating. The second criteria is evidence of increased male hormone. That might come up in the form of increased hair growth in areas of a male type pattern, like on the chin, above the lip, around the nipple, or under the belly button. In those 4 specific places, women may notice that they have increased hair growth. That might be a clue to you that you might have PCOS. She may also suffer from acne on her chest, her back, or along her jawline. And the third thing is evidence of multiple cysts on your ovaries. That's discovered with the pelvic ultrasound. So you have to have 2 out of 3 of those criteria to even have PCOS. So if that sounds like you, then you'd want to reach out to one of your gynecologists at Louisiana Women's Healthcare to discuss the further implications of PCOS. Why do we care? Why should you care if you have PCOS or not? Because PCOS can impact a multitude of issues for you. It can affect many different aspects of your life. Women with PCOS are at higher risk for having high blood pressure, elevated cholesterol, which can lead to heart disease. They're also at increased risk for having insulin resistance, and many of these women go on to develop diabetes. Many of them suffer from metabolic syndrome or the inability to lose weight. So those are big implicators for PCOS. For the gynecologist, PCOS again can cause irregular periods, which drives many women to the gynecologist, and it can also create infertility, inability to conceive. Some women with PCOS find themselves in the dermatologist's office struggling with hair growth or with acne. It can come in a multitude of ways in which it can show up in your life. So we want to make you aware of it, we want to educate you about it, and if any of those things are going on, that you can give us a call and get in for an appointment to see if you truly have PCOS or not and how we can treat it.